Hi, I'm Dr. Joe from the Southside Health and Wellness Campus. Thanks for joining me today. We're going to be talking about an important topic and a very big health concern for a lot of people, which is blood pressure. I talk to a lot of my patients each and every day who come in with a lot of health needs, and blood pressure comes up very frequently. So when I speak with them, I try to talk in terms of very simple description as to how the body works, and then by doing that, simple things that they can do to change in their life that may assist their health to improve and therefore assist in many good ways to lower blood pressure in many cases. So let's talk about this first and foremost. What is blood pressure? We have to kind of understand the basics. Blood pressure is basically the amount of force that's exerted by the blood inside of the blood vessels in the body against the blood vessel walls. Okay, so you can see the outward force that would be coming from fluid going through that tube, in this case blood vessels. So normally people are trying to figure out what their numbers mean. They say a number, the high number over the low number, and they don't totally understand those things very clearly. Well, basically we have what's called a systolic number and a diastolic number. And the systolic number is basically when the heart is contracting, there's a higher amount of pressure because it's working, so it's squeezing blood through the thousands of miles of blood vessels in the body. And then when it's in the relaxed phase, in between beats, that's called the diastolic number, and that's more of the at-rest number. So the ranges can be quite significant, but in most cases you're going to find a lot of people that are dealing with blood pressure issues may fall between 120 and 70 over 140 over 90. Now the parameters have changed a little bit here and there over the years, and in some cases they're recommending now that blood pressures at 120 over 80 should at least be closely monitored or possibly even medicated due to some concerns for too much pressure in the system in a person. Now, why would blood pressure being high be an issue? Well, ultimately, if the pressure is too high, and the numbers that can mean too high can vary in different opinions about that, but ultimately it can put too much stress on the organs, definitely the heart, and on the blood vessels, and could lead to stroke and many other injuries as a result. So to understand blood pressure, you also have to understand what is the purpose of the blood flowing through the body. Well, to simplify it big time, basically it's to get oxygen, nutrients, and hormones to the different parts of the body. Okay, so as you look up here, you're going to see a lot of different information, but I want to try to keep it as simple as possible. But ultimately, that purpose is really what the body is trying to do, to deliver nutrients and things to the rest of the body through the thousands of miles of blood vessels with each beat of the heart. So stick with me, try not to read ahead, just like on a test, don't read ahead, because it'll probably confuse you, but stay along and hopefully I can simplify a lot of these things for you. All right, so one of the things that can affect blood pressure is the heart as a pump. Now always think of the heart as a pump. Every beat is a pulse of the pump trying to push blood through the thousands of miles of blood vessels. So if you have a weak heart, okay, and it's not really very efficient at pumping, it's not going to get a lot of ability of circulation to all of the body. And in many cases, a person might be more apt to complain of like cold hands and feet, and their body just doesn't feel right, they're low energy, different symptoms like that. Well, if the heart is weak due to aging or heart disease or different issues, then ultimately the circulation will be decreased. Now the body has two options to deal with this. Ultimately deal with lower circulation and a lot of the symptoms that go along with it, or it can try to compensate for that in some of the secondary things that I'll talk about below, which may cause the blood pressure to elevate, or in some cases it can be very low in some people, and just getting up out of a chair or moving quickly may cause them to be dizzy, which would be on the low blood pressure side of things. Now if the heart is stronger, maybe they're younger or they're very active and they really condition their heart, they're a very physically fit person, then the circulation will be better, and the circulation will get better through the extremities and different things. And in that case, most times you're going to find a nice, even, healthy blood pressure, but in many cases, because the heart is working so efficiently, you'll see a person, especially as an athlete, that they're going to be in the lower blood pressure range and lower pulse rate, meaning the heart doesn't have to beat as much to get a good circulation to the rest of the body because it's very efficient. So secondary to that, blood volume over here is one of the most significant ways that blood pressure, is affected in the body. Now how does that work? Well, basically if you increase the volume in the bloodstream, you're going to increase blood pressure. Now one of the ways that this can often occur is when people consume very large amounts of sodium, which is why you often see people with blood pressure problems on sodium restricted diets. Now, although that can lower blood pressure some by not consuming that, sodium is a very important mineral and it does have to be consumed. However, there are better versions of it like Himalayan sea salt and Celtic sea salt, but not the traditional salt that's in a lot of processed foods. Now, if you have a higher volume, you're going to retain fluid. A lot of people complain about that. They'll often see that their blood pressure will elevate. Now, if you decrease the volume of the blood in the body, okay, and actually a lower amount, I'm not talking a significant amount, but just a smaller amount in the blood vessels, you'll often see the blood pressure will start to lower. Now, a better way to deal with it than just restricting sodium is actually to increase the very important mineral that opposes sodium, which is potassium. So we'll talk about that in a few minutes in potassium-rich foods, but by consuming potassium in large amounts, you'll often lower blood pressure versus just taking salt out of the diet, because like I said, it is very important to have a balance of both of those in the body. Another way that the body can have a change in the blood pressure is through the blood vessels themselves. Okay, now there's resistance that can occur. Now resistance is basically the amount of something is resisting you. So if I'm pushing on someone, they were pushing back, they're resisting me. Well, inside the blood vessels in the body, there's resistance. So if blood is flowing through a very narrow blood vessel, there's going to be more pressure on it. Okay, and that would ultimately cause an increase in blood pressure. Okay, now that can occur from a couple of different reasons, and one of them would be stress. Now, when you have stress in the body, there's certain hormones that are produced that will cause most of the major blood vessels to restrict. And the reason for that is it's called the fight or flight mechanism. So if your body is in a situation where it has to defend itself, there's a bear that comes out of the woods and I'm not expecting it, I have to defend myself against it or run really quick, faster than I ever thought I could run to get away from it. Well, basically the blood has to flow to the extremities or the arms to run away or to fight. And that's a survival mechanism. And as soon as the stressor goes away, the heartbeat slows down, the blood pressure regulates, and everything's good. However, when we live in a chronic stress state, we often have this continued constriction of the blood vessels, which may keep the blood pressure elevated even at times of rest, which is where doctors become very concerned about that. Additionally, inflammation in the blood vessels is also not good, which in most cases that's going to occur because of different foods that we consume, often lots of sugar or processed foods, both of which are very inflammatory. And if you can picture anything inflamed, it takes up space. Okay, so if I sprained my ankle, it would be larger and it would push out against my shoe if I was wearing a shoe. But also inside there would be pressure pushing on the interior components of the body. So if a blood vessel itself is inflamed, it's going to squeeze on the inside, therefore increasing blood pressure. So by avoiding those foods, that can be very helpful. Now, if I have a more wide vessel, okay, there's a lot more space in it, and I'm in a relaxed state, I'm just sitting around relaxing, maybe eating dinner or something like that, my body is going to have a much more relaxed blood vessel situation. If I don't tend to carry stress after the stressors end, my blood vessels will tend to be more relaxed, therefore keeping blood pressure lower. Now also, there's a flexibility that blood vessels should have. They're not rigid structures by nature. They should have a little bit of a stretch each time the heart beats. The heart kind of expands, okay, and contracts. On the contraction, it pushes blood through the blood vessels. There should be a slight stretching of the blood vessels. And then on the rest, the blood vessels will actually squeeze a little bit, helping to push the blood through the vessels. Okay, so if we have flexible blood vessels, we're going to have lower blood pressure in most cases, and that's what we want. And certain nutrition and things can help to feed the blood vessels to be able to do that. However, over time, and due to sometimes the way that we eat or the amount of stress that we have or different diseases and conditions, the blood vessels can become rigid. And if that occurs, instead of having this flexing, stretching situation, the blood pressure and the blood vessels will increase. Okay, so the pressure's inward and the pressure will go up. And that's a condition that we would often call arteriosclerosis, is a hardening of the arteries, or atherosclerosis, very similarly sounding. But the second one is basically cholesterol deposits and different deposits on the inside of the blood vessels. And what we eat, in many cases, high sugar and high processed foods, contributes to those conditions occurring in the body. Additionally, resistance in the body can be when the blood is trying to flow through the body, thousands of miles of blood vessels, feeding oxygen, nutrients, hormones to every different part of the body. It also has to go through the liver and most of its blood flow to try to filter out different toxins and irritants that can exist in the body. So if the liver as a filter starts to get congested, because over time, just like a filter, an air filter or an oil filter getting congested, anything pushing against it will cause the pressure, the back pressure, to increase. So think of an air filter in your house. If you pull the cover off and it's full of hair and dust and things like that, the air has to push a lot harder to get through it, if it can even get through it on the other end. And that can be called a term called hepatic or portal or liver hypertension. Okay? So if the liver is congested, we definitely want to try to increase its efficiency, and we'll talk about that in a moment as to how to do that. Blood vessels also have a lot to do with it. Now, if you have a longer blood vessel system, okay, let's say there's thousands of miles in the body, and now we gain a lot of weight, a lot of body fat. That body fat actually needs blood supply as well. So if you try to send a lot of blood through the existing blood vessels and then they get longer, there needs to be more pressure through the system to try to deliver enough blood to each of the nutrients, each of the parts of the body to give it all the nutrients that it needs. Okay? Now think of it this way. If I have a hose that's 50 feet long and I need to water something that's 75 feet away, greater distance, there's a couple things I can do. I can basically, turn the pressure up in the system, delivering the water through. I have to lengthen the hose. Okay, well, basically the body will go through an adaptive process to increase circulation, increase blood supply, grow new blood vessels to adapt to the amount of fat that's in the body. So obesity is definitely one of the biggest reasons that people will often have high blood pressure. So the opposite of that, when a person has less blood vessels and less body mass, there's less need to deliver all of the blood supply to a smaller body. And therefore, often when people lose weight, one of the first things that you'll often see is the person saying, I went to my doctor, my blood pressure dropped significantly, and now they're trying to lower my doses and taking me off of medications, which the people are thrilled to see that. And that's one of the fastest and easiest ways to help to assist the body through that process of reducing the need for medications. So, and lastly here, viscosity. It's right down here in the body. Viscosity is the thickness of a fluid. Now, if I have a thicker fluid, okay, going through a pipe, let's say molasses, the expression is slow as molasses. Molasses doesn't flow very quickly through anything, okay? You sit it on the table, it takes time to even seep out from its center point of pouring. Well, in a similar situation, the thicker the blood would be flowing through the blood vessels, the slower it's going to go through and the more pressure it would take. So therefore, blood pressure would elevate. However, if the blood is thinner, which would be great, then ultimately it's going to have less pressure behind it. Now, different things that can contribute to this, and it's a lot more complicated than I'll make it, but different toxins can build up, and if the blood has a lot of coagulation and stickiness to it, it'll kind of flow through slower, like the molasses I described. Dehydration can have a significant effect on that, because when something's dried out, it doesn't flow as quickly. So those are a couple of the different reasons that the thickening of the blood can occur. Okay, so what I want to do is not just educate you on what the body does, and I know there's a lot of information here, and at some point I want you to take a screenshot of this screen. Might as well take it right now. I'll get out of the way, so that you can see basically what the body is about. But also I want you to be able to take action on it, because ultimately if you do nothing with this information except store it in your brain and say, okay, I'm a little bit smarter, and don't apply it, it really will have been of no assist for you to have listened or watched this video. Okay? But ultimately, if we do some simple action steps, and I mean one or two of these, it'd be great to do all of them, but ultimately pick one or two by the time I'm done speaking, and if you start to implement it and put it into a reminder system in your calendar or something to remind you to do this thing over a week or two, eventually it becomes habit, then it might contribute to some improvements in your health over time. All right, so we have the heart pump, weak circulation, strong circulation. How do we strengthen a muscle? You exercise it. You move and you exercise. By doing so, you improve circulation, and the second example here, it's more efficient. The body has more energy. It's delivering oxygen to every part of the body, and that's exactly what we're looking to do. So we showed that sodium is not good in high amounts, but it's an important nutrient. So we want to avoid as many of the really processed foods that are overly salted, like a can of soup that has thousands of milligrams of sodium in it. But instead, more importantly, is to try to increase your potassium. Now, if you're able to do so, because some people are on potassium restricted diets, and you'd have to speak to your medical doctor about this, but eat foods like spinach and kale and Brussels sprouts and avocado and yogurt, if you're able to do things with dairy in it, and search out online how many other foods that have potassium-rich nutrients in it. Bananas do have a lot in it, but there's also a lot of sugar. Even though it's naturally occurring, we don't want to create inflammation in the body. Additionally, okay, deep breathing. We said that the purpose of blood is to deliver oxygen to the body, so if you do deep breathing, you will actually increase the oxygen carrying capacity of the blood. So your body will be more efficient and able to, to feed the nutrients in the tissues it better into the system. Okay, so how do we do that? Well, basically deep breathing exercises is great, okay, or when you're just even in life and you feel like you're feeling stressed, okay, you want to decrease stress, but one of the fastest ways to do it is to do a few deep breaths in, deep breaths out, and that'll help your body to lower blood pressure often instantly. I don't mean it's going to stay that way forever because you have to improve different systems, but that'll make a big difference right away. But obviously we want to try to find ways to de-stress as much as possible. Avoid the sugar, avoid the processed food. Obviously that speaks for itself. If the liver's congested, you want to consider a body cleanse. Now, people don't understand these real well. They hear the word detox and they're really confused. There's a lot of natural ways to do this. It's not just detoxing the liver, it's to detoxify the kidneys, the lymphatic system, the colon. All of those are part of the whole elimination channels in our body. And if we can slowly do that over time by the way we eat, not retoxifying it by more sugar and processed foods, then ultimately that will help the liver to clean out. Sometimes there's really healthy ways to do that. And I've seen people do natural detoxes, and believe it or not, they lose 10, 20, 30 pounds in 2 or 3 weeks in a really healthy way. And we see a lot of their health profile improve in very short fashion. So obviously we talked about losing weight. There's a lot of different ways to lose weight. Some people get very stressed and frustrated with this, but seek out help with this. That is one of the things that people will give up on the fastest. They feel like they've tried everything, but they haven't. There's a lot of different options out there. You know, as of today, there's the keto diet, there's the paleo diet, there's the Whole30 way of eating. You know, we love Weston Price, okay, and the foundation that's done dietary management and nutritional education for decades, okay? So search these things out, but definitely look for a coach or somebody that can help you with that. And if you need assistance, give us a call, look us up. We'd love to do so if you live here locally. And finally, we're talking about the thickness of the blood. The first and foremost thing is hydrate. Okay, the most important thing is not to just drink coffee and soda and tea and all these things with caffeine in it. It's to drink water. Water has a cleansing ability. It also has a thinning ability for the blood, and it's just a really good thing. It's not like people think if you drink water, you will retain water. It's not that. It is that mineral balance we talked about with sodium and potassium. So if you consume a lot of live, rich foods, the green leafy vegetables and salads and things like that on a daily basis, you will get water from that, but definitely try to consume large quantities of good water, and maybe even put a pinch of sea salt or some lemon or some apple cider vinegar in the water. That will help to hydrate you as well. Additionally, if you're able to do so, and your doctors wouldn't disagree if you're on medications, fish oil and or flaxseed oil or omega-3 fatty acids, very helpful to keep the blood thin and can make a really big difference in a person's health overall. Also helps to reduce inflammation. So as we spoke of earlier, that will help the blood pressure to reduce in many ways. I know I said a lot about this, okay, in a very short period of time, hopefully not keeping you too long, but ultimately try to understand the simple elements of the body and then walk through the process of the things that you can do to make a difference, okay? But don't get overloaded by all of this information and think you have to change overnight. 1 degree of change can lead to tremendous improvements over the course of weeks and months. So that's all our goal is here today, and I hope that this will be assistance to you. Please share this information with other people. I know so many people, upwards of half of the American population has blood pressure issues. So basically, if you know people that are dealing with this improperly or not having good success with it, give them this information, let them go through the process themselves, and then hopefully you can take some credit for making a difference in that person's life. So thank you for your time today. I hope that this was helpful, and please stay tuned for additional videos that we are producing to try to make health as easily understood as possible and simple. Thanks again.